and I work in our WGU Career and Professional Development Office. And I am very excited to introduce Danielle to you tonight. Danielle works with Wyandot Memorial Hospital, who is one of our Renew partners located in Upper Sandusky, Ohio, which I think of just Cedar Point is what is there, but Wyandot as well. So very, very exciting to have you here and to talk to us a little bit about, right, launching your healthcare career, kind of that career decision making, and also to hear about your journey. So, welcome, Danielle, and thank you for joining us.
Yeah, thank you for having me, and thank you all for joining. As was said, my name is Danielle Pagnard. I am the Vice President of Clinical Services as well as the Chief Nursing Officer here at Wyandot Memorial Hospital. I'm excited to kind of go over today to have an honest, real world conversation about launching your healthcare career. I think my goal here today is really to just to share with you I wish someone would have told me when I was in your shoes, practical guidance you can actually use as you prepare to enter into the workforce. And as Azra said, we will have time at the end for questions, so please feel free to put those in the chat. So a little bit about me, so you know kind of where my perspective is coming from. I've spent my career in clinical leadership, starting at the bedside and working my way through progressive leadership roles. As in my current role, I oversee nursing and clinical operations, patient care quality, and clinical strategies at Wyandot. I not only oversee nursing, but I also oversee our respiratory. There's a long list, I'm not going to lie. Respiratory, sleep lab, pharmacy, therapy, wellness, lab, cardiology, urgent care, job care, and radiology. So I kind of have a plethora, pretty much any clinical area that you can think of, I oversee. And if I don't oversee it, I have some sort of oversight in terms of nursing. Kind of what drives me every day is empowering healthcare professionals, especially those new nurses or new healthcare professionals starting out. I believe in mentorship, professional development, and creating environments where people can thrive. They really have guided me through every decision that I've made in my career, and I hope to pass some of that perspective on to you today. So kind of a little roadmap of today's session. We'll move through these key areas, plus a look at kind of why Wyandot, and you'll see that as we go throughout these slides. I'll share a little bit about my career journey, kind of a little bit more in depth, how I got from nursing school to the C-suite, and the lessons I learned along the way, because there have definitely been a lot, some easy and some hard. Finding your fit, I think that's probably the most important thing right here. Not every organization is going to be the right match for every professional. I'll hopefully help you think critically about what to look for when evaluating those potential employers. Compensation, we'll get into a little bit about that, not just the salary, but also the full picture of benefits, incentives, market trends that you should understand before accepting your first position. Building with purpose, I think this is truly the most important one that I can think of. And, healthcare isn't a marathon, or is a marathon. It's not a sprint. We'll talk about building career rooted in purpose and growth to set yourself up for long-term fulfillment, because these jobs aren't always easy. And then why Wyandot? We'll talk throughout the session, we'll weave into what makes Wyandot Memorial Hospital a great hospital to consider when you're looking for employment. So a little career journey throughout my nursing degree. So I graduated from Ohio State University in 2008. Shortly after graduation, my husband wasn't able to find a job. Jobs were really difficult at that time. He was a business degree. So we made the decision to move out to Seattle, Washington. There I began my nursing career at the University of Washington Medical Center on their bone marrow transplant and hematology oncology floor. We had our first daughter and eventually decided to move back to Ohio to be closer to family, where I joined Ohio State Wexner Medical Center on their bone marrow transplant floor at the James Hospital. In kind of both of those roles, I served as a charge nurse fairly early on in my career. and took an expanded leadership responsibility, informal leadership responsibility, as both the vice president and eventually president of their unit councils. I do truly attribute much of my professional growth and leadership development to that experience at both of those facilities, particularly through the opportunities that were offered and provided through their shared governance structure. When the opportunity arose to return to my husband and I's hometown, which is Upper Sandusky, where I am currently, we made that decision to do so, mostly because of we were having more children and we wanted them to have that small town atmosphere. So that's where I ended up taking a job at Wyandot Memorial Hospital. Initially starting in their ICU, later transitioned throughout the ER, and eventually serving as the ED director. And now currently my current role. When I first started in this role, I was only the CNO. And then when our COO was promoted to the CEO, I also took over a majority of her duties as well. You know, my journey started exactly where yours is about to, at the bedside. I was a new grad, nervous and excited all at the same time, learning the fundamentals of patient care. I think the biggest lesson I learned, your career doesn't have to follow a straight line. You know, what we're lucky for being in the nursing profession or healthcare profession is there are a ton of opportunities available to you. And that can also challenge you. My bedside nursing years were invaluable to me. I learned a ton of clinical skills, but more importantly, learned how to communicate with patients and colleagues, advocate for their needs, and work as part of a team. I think those have been invaluable to me, especially in my role now, especially when you have a patient who, you know, or a family member who may be upset, and having those difficult conversations. I truly think bedside experience is the foundation that everything else is built on. Even, like I said, even professionals who move into leadership, education, clinical informatics, whatever it may be, will draw on those clinical years early on. My leadership role, so it, like I said, kind of a little bit in the previous slide, it really found me before I was looking for it. I can't say I went into nursing saying my ultimate goal was going to be being a CNO, but that's where I ended up landing. And that's because a mentor encouraged me to take on a charge nurse role probably before I thought I was ready, which opened the door to eventually management and eventually where I am now. Leadership doesn't always mean admin. Like I said, there are a lot of informal leadership opportunities: charge nurse, preceptor, committee chair, a quality champion even for your department. All are leadership roles that allow you to stay at the bedside. I'd encourage you to say yes to opportunities, even when you feel unready. Like I said earlier, growth often happens outside of your comfort zone, and a lot of times, like I said, you know, someone else sees it in you before you see it in yourself. Executive leadership. I think the quote on this slide is something I truly believe in. Every step has taught me something essential throughout my career. There are no wasted experiences in healthcare, because even the tough days will teach you something. My leadership approach really is grounded in my bedside experience. I would not change that for the world. It has let me do the things that I've become to do and feel comfortable making decisions moving forward. So, finding the right fit. This is probably the most important slide in today's presentation, I would say, overall. Your first job sets the tone for your entire career. It doesn't determine it. You can always make that change, but it does definitely kind of lead the path you're going to take. So one of the things to consider are culture and values. I think they matter enormously. Just some things to think about, you know, during interviews, ask the organization's mission. Ask about it. Does it resonate with you? Do the people you meet seem to live those values? Ask how leadership handles conflict and ethical dilemmas. This can reveal a lot whether values are practiced or just kind of posted on the wall, but not really thought through. Look how the organization treats support staff. Your nurses aide, housekeeping, and dietary staff are going to be your best friends. You cannot be a nurse without them. So a truly values-driven culture respects every single role, not just the clinical. Team environment. pay close attention to the team environment. It's really hard to work in a department that isn't team oriented. So ask to shadow or meet the unit team if possible. You want colleagues who will support your growth and not just wanting to fill the position. Notice how nurses interact with others during your visit. You know, the hospitals, the person interviewing you should be wanting to take you around to show you the department. Ask about staff retention and turnover rates on the unit. You know, I think during COVID, high turnover rates is a red flag. Not necessarily uncommon, but I think nowadays, now that we've started to see a lot of these positions be filled and it not be such a nursing shortage, that it probably could be a little bit of a red flag for you. Orientation program, I think, is a very important part, especially as a new grad starting out. A strong orientation and residency program is important. I think organizations that are willing to invest 12 or more weeks in onboarding new grads or more, sometimes it's even 6 months, are telling you that they care about your success. Find out if orientation length is flexible. You know, sometimes you get into a role, especially if it's an ICU or let's say surgery or even the ER, that 12 weeks isn't quite enough. You may need to extend it a little bit. So see if they're willing to do that. And also look to see if they have simulation labs, skill checkoffs, didactic education, and not just the shadowing, because the hands-on is important. Ask if the organization participates in nurse residency program. I think this is becoming more and more common. For us at Wyandot, we started this about 2 years ago, probably a little bit later than some organizations, but it's something that has really helped our new grads be successful moving forward. Work-life balance. It really is essential to a sustainable career. I think COVID showed us this. Ask about mandatory overtime policies. Some hospitals rely on mandatory overtime, which can lead to burnout, especially for new nurses. Find out if self-scheduling is available and how far in advance those schedules are posted. Kind of helps you manage your life outside of work a little easier. Growth pathways. Look for clear growth pathways. Can you pursue certifications? Is there a clinical ladder offered within the organization? And will they support you if you go back to school? Ask about internal promotions. You know, oftentimes smaller hospitals, you can be promoted faster if it's appropriate, especially into a charge nurse, even an educator or leadership role. And then look for organizations that encourage nurses to join professional committees. I think it's important, like shared governance or something that they may have. It really will help you build your resume and expand your skills. And then reputation and safety. I encourage you before you come in to do an interview that you do your research on safety and reputation. Some things you can do is look at the CMS ratings and what current or former employees will say about working there. Ask about the organization's safety reporting structure. Do they encourage those near misses, incident reporting without blame? And then look at the community perspective. Would you bring your own family here for care? You know, that gut check really can say a lot. So evaluating health systems. These are actionable steps you can take before and during the interview process. Again, beyond just looking at those quality measures, you can look at magnet status and patient satisfaction scores. You know, the CMS Compare Everywhere is one where you can look, but you can also look for, you know, their HCAT scores, readmission rates, hospital-acquired infections data. I do want to mention, I know magnet status is on here, that not every great hospital has magnet status. It's very expensive to pursue. There are a certain amount of bachelor degrees that you have to have within your organization and things like that. So it's not always the best way to look at if an organization is great or not, but it is something to consider. Instead, I would look for signs of a culture that values healthcare in their employees, which would be a good thing to look at. Ask about the shared governance. Do they have evidence-based practice councils and nurse-led quality initiatives? All right, so let's talk about money because it does matter. I know it matters, but I think there's a lot of things just beyond the base salary to consider. Um, and considering the total package, even think about what matters most to you personally as a person. So base salary, it is just the starting point. Something to consider is look at what other new grads within your area are making. Don't forget about those shift differentials. Evening, night, and weekend shifts often come with significant pay bumps that you may not be considering when you're looking at just that base salary. Um, don't forget about the cost of living. That does matter. A $65,000 salary in Wyandot County, where I live, is a lot different than a $75,000 annual income in let's say Columbus, Ohio, or something. So just remember to consider that. And then there's always room for negotiation. Sometimes it's the shift preference, your start dates, your sign-on bonuses, and even hourly wage. Benefit packages, I think this is where the real value often hides. A lot of people are so focused on that hourly wage and aren't considering the things that are kind of hidden behind the lines. Sometimes a slightly lower salary with excellent health insurance, generous PTO, and retirement matching can be worth more than a higher base with minimal benefits. Tuition reimbursement is another thing. They're increasingly common and can save tens of thousands of dollars over time. So if you work for an employer that is willing to pay that, take that into consideration as well. Ask questions regarding employers' retirement matching, because even a 3 to 5% employee match can make a huge difference long term. And then don't forget about your employee assistance programs. There's a lot of times fitness reimbursement opportunities, PTO banks, and student loan repayment programs. And then lastly, market trends for this section. Luckily for you, all of our healthcare demands continue to grow. You can pretty much find a job anywhere you want. Specialty certifications like CCRN, a CEN, there's some oncology as well as like radiology and things that you can consider. Those can significantly boost your earning potential, especially if they have a clinical ladder program. Sign-on bonuses are pretty big right now. I don't know the last time I looked, and there probably wasn't a sign-on bonus related, but just make sure you're reading that fine print. Most do require some sort of year commitments to those, and you'll have to owe it back if you were to leave early. One thing I do want to address is the travel nursing kind of phenomenon that's been happening since COVID, because I know some of you may be thinking about that. The pay can be very appealing, but it's important to understand the trade-offs that come with that. Limited benefits, no seniority, and less opportunity for building those relationships because you're kind of moving around all the time. My advice is to focus first on building a strong clinical foundation, because I think that experience will set you up for success in the long run, even if that leads you to travel nursing later on. And then rural and community hospitals often offer a competitive total compensation package, not necessarily hourly wage. So again, I just encourage you to take all into consideration. So building a career with purpose. This one is really near and dear and close to my heart. Like I said earlier, I know a paycheck is important, especially given the cost of everything right now. But I truly think that nurses who thrive long term are the ones who connect to their work and to something bigger. Patient impact is the core of why we do this. This is why you go into healthcare. Even on your hardest days, remember you are making a tangible difference in someone's life. That's not an abstract idea, and it's real and it does matter. At our small hospital like Wyandot, a lot of our nurses and our employees are taking care of the same patients and families over time, and they continue to create a deeper relationship and a more tangible sense of impact. Oftentimes they're taking care of their friends, families, and loved ones. And so being able to build those relationships is important. Lifelong learning does keep you engaged and growing, whether it's pursuing your bachelor's, your master's, or even a specialty certification. Never stop investing in your knowledge. There is a lot of opportunity that opens up to you as you continue to pursue those education opportunities. Community service, extend your nursing impact, really beyond just the hospital walls. I think especially as you move up, if you decide to go into leadership and administration, this is probably one of the most important things you can do is get out into your community so they can see your face and build those relationships. Many organizations do offer opportunities for health fairs, school screenings, outreach programs. Here at Wyandot, we have a lot of employees that participate in our school partnerships, whether that be our BLS training that we do. We're getting ready to do Stop the Bleed training with our high school teachers, as well as I'm hoping to do them with the students at some point. And then we have our athletic trainers contract, and then wellness screenings as well. So we have Flu Before Boo. We have health fairs with local businesses where we administer vaccines and blood draws, things like that. And then your professional voice, find that early. Join committees, attend conferences, and contribute to policy discussions. We truly do need your perspective, even especially as a new voice in the field. You guys can come with a lot of ideas that we may not think of because we're so stuck in it every day. Shared governance is a key way you can do that. It empowers clinical staff to actively participate in those decision makings, influence practice, improve patient outcomes, and shape policies. I would also encourage you to consider joining a professional organization, whether that be ANA, OHA, whatever your state organization is, and do it early. Student memberships are usually discounted and provide a lot of advocacy opportunities for you. And then I'll just end with saying on this one, purpose isn't something you find once and hold on to. It evolves as you grow. So stay connected to what matters to you and your career will follow. All right, so just a little bit about Wyandot and kind of like what I said at the beginning, why Wyandot. This is a little bit about our vision, mission, and purpose. So Wyandot Memorial is located in Upper Sandusky, Ohio. We're a 25-bed critical access hospital, joint township owned, which isn't very common anymore, that serves Wyandot County and its communities. Since 1950, we just celebrated our 75th kind of anniversary celebration. This really started because some of our local leaders just realized that a lot of our community members all of our community members were having to seek care outside of Wyandot County. And so they kind of all came together and made the hospital happen. Prior to COVID-19, we employed approximately 250 employees, and we now employ 471. So in a matter of 5 years, we have grown by 220 employees. And that truly reflects the expansion of services and ongoing commitment to meet the needs of our community. We often hear from them. We try to bring that back to our strategic planning and how we can set them help with what they need. This really does introduce the heart of who we are as an organization. Our vision, your first choice for healthcare. We want to be the place people choose, not just the place because we're nearby. Continuously investing in our employees and employee engagement. And I think sometimes for these critical access hospitals, sometimes people will think it's just a stepping stone, but it doesn't have to be. You can build your entire career here. Our mission, keeping our promise to be your hospital. I think it reflects the commitment we made when the hospital first opened on September 25th in 1950. This founding promise really still drives everything we do all those years later. Our purpose, providing compassionate care while continuing to connect communities. We actually just changed this with our last strategic plan. I think it speaks to both the clinical and the relational dimensions of healthcare. We're not just treating conditions, we're building relationships with people and families that we see again and again. So we live by our promise. This is our values. I'm not going to go into a lot of detail here, but these are the one I will kind of talk about a little bit is our excellence pillar. Our CEO often shares a story that I'll share with you guys because I do think it resonates with a lot of people. She brought her daughter into our ER. This is years and years ago. And the visit wasn't going as planned. She was frustrated. Her daughter was crying. Her husband was frustrated. And as the nurse walked out, her husband looks at her and says, "My gosh, Kendra, did they not know you work here?" And she's like, "But they shouldn't have to." And they shouldn't. We should treat every patient the same every single time. So meet Mary Jo Wyandot. She is probably one of my favorite people, even though she's not real. She is our composite patient, representing the typical community member that we see here at our hospital. She's a single parent with 3 children, one of which has special needs. She has a full-time job and has difficulty paying her bills, unreliable transportation. Her mother resides in a facility. She uses her smartphone as her primary communication. Her brother has behavioral health issues, and both parents are living and have extended health issues that she's kind of responsible for managing. So she does sit, I am so sorry. She does sit at our board meeting. She has a place. So every decision that we make, she is who we think of at the back of everything. So this is just more some of our benefit package that we offer. We do have medical, obviously starts on your very first day of employment, no waiting period at all. Our dental and vision does start the first of the next month of hire. And then we offer pretty much all of the typical, the EAP, financial counseling and things like that you can think of with the other hospitals. I would say our financial and retirement is probably the thing that is the most important here. We are part of OPERS, so our Ohio Public Employees Retirement System, which provides a benefit pension. The employee contributes 10% and the hospital contributes 11%, which is pretty big compared to most places. We have deferred comp and all the other stuff that you can think of. Education and loan support. We do have a tuition assistance program here. We also recently started paying for nurses as well as some respiratory therapists to go back to school if they do commit to us for 3 years, but we pay for their schooling outright. And then time off and work-life balance. Obviously, I think a lot of places offer just a generic bank. We offer paid vacation, holiday, and sick leave, which I think in the end does give you a little bit more benefit time to take time off if needed. Advice for healthcare professionals. So these 6 things I think are really just come straight from my experience and from watching, hundreds of new people, new nurses, new healthcare professionals navigate their first years as well as myself. So just some things, remember to be patient with yourself. You will not know everything on day 1, day 30, or day 300. I'm still learning every day, and I've been doing this for 18 years. The learning curve is steep, and that is normal. Research does show it takes approximately 12 to 18 months for a new grad to feel truly competent. So give yourself grace during that transition and recognize that growth does take time. One of the things that you can consider doing is, keep a wins journal. It's a simple notebook where you can record positive moments from each shift, because on those hard days, this is a powerful reminder of the progress that you have had. Find a mentor. and really as early as possible. And this doesn't have to be a formal arrangement. If the hospital doesn't offer a mentorship, find one yourself. It can be someone that is more experienced nurse on your unit who you trust and respect. Stay open to their feedback, even when it's hard to hear. Ask questions. Never stop asking questions. Curiosity is not a sign of weakness. The people who ask why are the ones who catch the errors and improve the care. Many new grads, often worry about asking those questions because they're worried it makes them look incompetent. But I assure you, nurses worry more when you don't ask. I encourage you to get in the habit of asking why behind orders and protocols for that same reason. Invest in relationships. Healthcare is a team sport. The relationships you build with nurses, physicians, respiratory therapists, social workers, pharmacists, housekeeping, whoever it may be, will make you a better, more effective healthcare professional. Respect every role. The best nurses understand that patient care is a team effort from top to bottom. Small gestures such as, learning names, saying thank you, offering help, go a long way. Prioritize your well-being from day one. I think as healthcare professionals, this isn't something that we are always great about. We're great about taking care of other people, not necessarily ourselves. But do not wait until you are burned out to start taking care of yourself. As healthcare professionals, it's important. Establish healthy boundaries, find outlets outside of work, and ask for help when needed. Let's see. Remember your purpose. This is, like I said, on the other slide, this is the most important thing, I think. On the tough days, and there will be tough days, it's healthcare. Come back to your purpose. It will carry you through. Write down your why before you start your first job, and keep it somewhere you can revisit it, whether that be in a locker, your phone, a journal that you carry with you. Because when the reality of the jobs get overwhelming, that original spark matters. And that purpose may change as you continue to get into your healthcare journey, and that's okay. So kind of wrapping up, I want to leave you with these four messages. Fit matters more than salary. I still will say that. I know money is important, but a supportive environment where you can learn and grow will serve your career far better than an extra few dollars. Money only does talk for so long. I've seen it with my own experience. Think about what supportive means to you personally so you can evaluate the fit with intention. Understand the full compensation picture. Look beyond just that base salary. Remember that benefits like tuition reimbursement and loan repayment can be worth a lot of money in the long run. Build your career around purpose. Be intentional about pursuing them. Here, we're experience of daily care for your neighbors. We take care of our patients every single day, including a lot of times our own loved ones. I encourage you to define what purpose means to you, knowing it evolves as your career does mature, as I said. And you do have the power. You are not at the mercy of the job market. You get to evaluate employers just as much as we get to evaluate you. Be strategic, thoughtful, and trust your instincts. A couple of interview questions, I'll leave you with just those a little bit to consider. Ask, can you tell me about your orientation program? What does professional development support look like here? And how do you handle staffing challenges? I think that will give you a lot of clarity when you're trying to decide what is the best fit for you. All right, so.
Fantastic.
Any questions?
Yes. Feel free. I didn't see any questions come in the chat, but feel free to put them in the chat or use the raise hand function, and you can come off mute as well. While you guys are thinking, I'm going to pick on Nick for just a moment. If you wanted to talk a little bit about our WGU partnership with Wyandot, just kind of as we talk a little bit about benefits and educational benefits, especially. Take it
Thanks,
away, Nick.
Ezra. And thanks so much again, Danielle, for all the information you shared tonight. It was wonderful learning more about your journey heading out to Seattle and then coming back to Ohio. And I really enjoyed learning more about you and about Wyandot. And just wanted to introduce myself. Grateful to sit as a healthcare partner success manager here at WGU, supporting the partnership with Wyandot. We are truly grateful for your collaboration, and you shared some of it. The opportunity for your employees to pursue degrees, and that's what I get to do on a daily basis, work with other healthcare organizations like yours and upskilling talent. And we're grateful for all of our students who were able to join us tonight. But RN to BSN, pre-licensure, there's a huge need for nurses, and WGU is uniquely suited to serve individuals like Mary Jo Wyandot. I love that she sits on your board, and the WGU is able to help individuals who are interested in supporting their communities, and who may have had some challenges throughout life, but we're mission driven like you are, and I loved all of what you shared about doing it for the right reasons and being connected to that mission. And thanks again for the presentation tonight and for your partnership.
Yeah, thank you. We're looking forward to it. I know that it's been great so far. It looks like there was a couple questions in the chat. So
yes. Do you want to take it away?
Sure.
Yeah. Okay.
One of the questions is, was there ever a time when you didn't think you were on the right path within nursing? I would say not necessarily. I kind of always knew I wanted to be a nurse. I will say I did not realize I was going to be bone marrow transplant. I was determined when I came out of, when I was in my nursing degree, I was going to be a pediatric nurse. That's what I was going to do. And then I did my senior practicum on bone marrow transplant, and I never looked back until I moved back to my hometown. I will say I have seen other people who have gotten into nursing and just not necessarily felt that they were in their right path, and that's okay. The pleasure of nursing is that you can do whatever you want. There are jobs everywhere, and there are always opportunities. It's probably one of the most the career that has the most options for you. So don't ever be discouraged by that, because there is something that you will find.
Speaking of that, there was another question in the chat too, right? So with health systems competing for new nursing talent, what kind of trends are you seeing? Especially, for some of our students who are just starting out, who might be graduating in a year or 2 or 3, any trends that you're seeing, things that they should keep their eye on, especially as it comes to like finding your fit or negotiating
I'm
the
not
salaries.
necessarily seeing trends, but I think the thing I am seeing is that they're being recruited very early. Like some of these people will have jobs. Some of these new nurses will have jobs a year before they even are graduating. And so a lot of that is happening during clinical rotations, or if they are working as an aide. That is probably the biggest thing that I'm seeing. And then some hospitals may compete with a bigger, sign-on bonus or things like that. But I like I said, I do think it's important to look at the entire package and not just that salary or sign-on bonus, because long term, if you stay there, there's a lot more potential there.
Absolutely.
Yeah.
And there's another question here. How do you deal with people that downgrade starting nursing school?
Oh, they don't know what they're missing. I can't imagine doing anything else. I know I may not be at the bedside anymore, but I can't imagine not being a nurse. So for someone to downgrade starting nursing school, they don't know what they're missing. And they don't realize how hard it is. I wouldn't worry about it, to be honest with you. I think it's the biggest career for growth, for your purpose, your reasoning for what you do. So I've never had anybody downgrade me wanting to go to nursing school or being a nurse. I hope that answered your question.
And I think too, as we see in your example, there's so many different ways that you can go, right? I know you mentioned the specialty trainings and right, the different paths and different types, right? I mean, yes, right, like hospitals, but there's also long-term healthcare. There's so many other options, school nurse, like there's so many other options and ways you can take your nursing career. So I love that. And this is why we bring in speakers so that you can kind of see all of these, all of these career journeys.
You know, sometimes people do get burnt out of bedside nursing. I mean, it's hard. I'm not gonna lie, it's hard, but it's also very rewarding. And so sometimes stepping away for a little bit is what you need to do, and you can eventually, maybe some do, some don't, come back to it, and that's okay.
And so while folks are still thinking of questions too, I know you mentioned mentorship a lot. For someone early in their, like some of our students just started, especially the pre-licensure nursing program, what kind of good advice or tips do you have for them finding a mentor or even a champion, right, that can maybe help negate some of those other comments that you're getting, maybe especially from family and friends? But how do you go about kind of finding that mentor if you're not already, doing clinicals or working in that system?
I think it's really just finding out who you connect to the most. Like I said in my presentation, it doesn't have to be a formal mentor. So if you have somebody that you've connected really closely, it could even be your preceptor. That can be your mentor. It could even be someone outside of your department. If you know someone else that works here and is a nurse, they can be your mentor. It doesn't have to be this formal thing. So that is probably the biggest thing I would recommend. Is it's really you have to have that connection with them for it to be beneficial to you.
That's a great point. All right. Here's a question. What do you think about starting as a psych nurse right after graduation?
Yeah, I think I mean, it kind of depends on if that's what you're passionate about, go for it. I know a lot of people that have. I don't have any, guidance to whether you should or shouldn't. I think you have to do what's best for you and what you're most passionate about.
Other questions? One of my greatest skill is communication. Which career path can I use that tool in?
There's a lot you can use it in. Starting out, I would say definitely bedside. It can be, because there's a lot of education that has to occur with the patient and the families. But that could be really any nursing position that you can think of. As you grow into your career, a staff educator or a patient educator thing would be a really good opportunity to consider. Or an educator. Going and getting your master's and considering going to the colleges. You could take over my role too. That would be a good one.
That's fantastic. No, and very true, right? There's lots of that in leadership. But I love geriatrics too. Yeah. Other questions?
That's for sure. Does our organization accept student nurses, nurse techs? If so, how many per year? We do accept nurses, nurse techs. We don't necessarily have a certain number per year. It's kind of open to what's available. We are looking at some internships as well. And we're thinking probably about 5 a year for that. But again, if we have great applicants, we may flex that a little bit to make sure we have a good candidate.
I love that. Good question.
Mhm.
Don't be shy. Feel free to.
I know some of you had kind of put in the chat what you're thinking, but those of you that haven't talked, is there kind of a career path that you've already kind of thought you want to do? I don't mean to put you on the spot. L&D. Unfortunately, we do not have L&D here. That was probably one of the hardest decisions that we had to make as an organization when the law passed that you had to have the 2 OB nurses on site at all times. We just didn't have the volumes to sustain that. So my sister's an L&D nurse, so kudos to you for wanting to do that. Oncology, ER, I've done both of those. Highly recommend them. I will say, I think one of the things that's great about oncology is those are patients that you truly do see for months on end. Some of my bone marrow transplant patients we saw for 3-4 years, and so you do really build those relationships with them. Midwifery, that'll be fun.
I had midwives with both my kids and loved them. So yeah, that's awesome.
They're amazing.
I'm rooting for you. All right. Any other last questions, thoughts? Otherwise, I'm just going to go ahead and drop just the survey again, because we want to hear from you all, as well as a link to our career site. So our team is constantly bringing in different speakers, different organizations, hosting different events, just to give you a chance to connect and hear about different career journeys and write and kind of get different perspectives, and of course expand your network. So please check those out. And then also just a huge thank you to you, Danielle, for your time, for, I think, some really great advice, a lot of things that I learned. And, you know, I think you've heard it all in career development and you haven't. So I've learned a lot of new things about nursing and tips and advice. So I hope everyone did as well. Thank you all so much for joining us this evening. And you will receive a follow-up email with the recording from me and some of our resources as well. So thank you, Danielle, so much. And thank you everyone for joining us tonight.
Thank you for having me. I hope it was beneficial to everybody.
Oh, absolutely.
Yeah.
2 thumbs up.
Thank you.